All right, so let's move on to the urinalysis example. And so, Dr. Hanlon, what can you tell us about this lab?
Sure, and I will just preface with the urinalysis, or some people call it a UA, urinalysis, is very common to get in a doctor's office and in the hospital. I think, a lot of people most commonly when they think of a UA, they think of, testing for a UTI or urinary tract infection, and that is one of the things that we can test for with a UA. But I'll just briefly, mention a few other things that you can look for, that you're looking for on a UA. And then, what may indicate that someone has a UTI. That's probably the most helpful thing to get from a UA, a urinalysis. And these are the report you're getting here is just sort of a printout of the dipstick test that we use in the clinic and in the hospital setting. It's just sort of interpreting those results that are different colors and then putting it on a sheet. So the first two are really just a description of the urine sample itself. So just looking at it, what we would say grossly looking at it, or just looking at it as urine. It's yellow, it's hazy. Specific gravity has to do with how dilute or how concentrated the urine is. Simply put, the closer that number is to 1, the more dilute the urine is. So like the closer that number is to 1, the closer it is to like specific gravity of water. So what I mean by that is if someone's specific gravity is nearly 1, say 1.008 or 1.003, their urine is pretty dilute, meaning they've been drinking a lot of water. There's a lot of water in the urine, so that specific gravity is pretty close to water, which is 1. If that specific gravity is high, like 1.1 or 1.3 or even 1.05, those indicate that there's not that much water in the urine, meaning that person is probably dehydrated or their urine is concentrated for some reason. So just keep that in mind. If someone comes in first thing in the morning and you get the dipstick and their specific gravity is super high, it's probably just because they haven't been drinking because they've been sleeping all night. So they're a little bit dehydrated and their urine first thing in the morning is pretty concentrated. Next, the things like the pH and certain lab values in this urine sample, they aren't going to be super helpful in the clinic setting. I think what's most helpful and what is most things that you need to know would be the leukocyte esterase. So it's that lab value right below the pH. It says leukoesterase, and the nitrites, which is right below that. So leukocyte esterase and nitrites are really the two primary tests that we use to look for signs of infection in the urine. Leukocyte esterase is I would call it like a byproduct or an enzyme related to white blood cells. This might also just be called leukocytes on some tests, but it's looking at white blood cells in your urine. Again, like we learned before, white blood cells have to do with the immune system. So if you have an infection in your urine or in your bladder, there are going to be white blood cells there attacking the infection. So we can see those on the urine. If they're high, it looks like this report says moderate. Sometimes it will be a number, sometimes it will be like a 3+, or sometimes it will say low or moderate or high like it does here. And then the nitrates is also important because nitrites are a byproduct that are specific to some of the most common bugs that cause urinary tract infections, like E. coli or other bacteria that cause UTIs. So if both the leukocyte esterase and the nitrites are positive, chances are there's bacteria somewhere in there. It's important to note, though, if the patient is not having any symptoms of a UTI, so if they're not feeling like they have to go to the bathroom, if they're not having any pain when they go to the bathroom, no symptoms of a UTI, no, tenderness kind of where their bladder is, but they do have positive urine results that may suggest a UTI, they might just be what we call colonized with bacteria, or that there's bacteria sort of chronically in their urinary tract system, but it's not causing an active infection at this time. If someone is having symptoms and they have, the leukocyte esterase and the nitrates positive, then yes, that's definitely a UTI and you should treat it. Let's see, other things here. It's also, as we can see here, things that would be helpful and point us towards a UTI, a urinary tract infection on this testing would be down near the bottom. It says bacteria. So bacteria in your urine, and it says present. So that's also helpful in maybe pointing us towards a UTI. But something to note or something to be aware of is we can sometimes have false positive results, meaning that the bacteria in your urine can be present if they didn't have a clean catch, right? So if they didn't, wipe with like a towelette from front to back prior to peeing, and then if they didn't catch their pee midstream, and if it wasn't like all completely a clean catch, then there could be bacteria present in your sample. And then I guess just below that, the thing that says squam epi, that stands for squamous epithelial cells, and that's just skin cells. So if there's skin cells present, and right here that says there's one, sometimes there'll be 20, 30, even more. If there are skin cells present in the sample, that tells me it was definitely not a clean catch. So just something to be on the lookout for. The rest of this is really more for the nephrologist and more for the provider to kind of, if they have specific questions about renal function, these can be helpful in determining things related to that. But just for the purpose of a kind of a simple UA, the most common reasons you'd use it for, I think the leukocyte esterate and nitrites, if those are both positive and the person's having UTI symptoms, that's pretty slam dunk UTI. And then if there's bacteria present, could be UTI, but it could also be that the sample was not a clean catch, especially if there's some squamous epithelial cells in the sample as well. That probably means it was not a clean sample.
Thank you. So I do have kind of a question then in terms of like the nitrites and protein and glucose and ketones. So you're saying those are values and tests that a nephrologist might use to look at kidney function?
Yeah,
Is
or
that what you're
even the
saying?
primary care doctor, they out of context, just looking at them, they don't tell you, oh, this person has any one particular disease. But in combination with the other blood tests you've gotten and knowledge of the patient, they can help you to sort of figure out what's going on with the patient. But any one of these tests on its own isn't like specific for any one disease.
Okay, thank you. Then it's just one more little piece of the diagnostic puzzle to try
Yes,
to figure out what's wrong with the patient. Okay,
exactly.
great. Well, thank you very much. And again, if any of you have questions, just shoot me an email and we'll get you the answer, okay? Thanks again, Dr. Hanlon.
All right, thanks so much. Have a good day.
Bye-bye.